If you wear removable dentures, whether it's a full plate or a partial framework, you might have noticed something frustrating over time. Maybe the color has shifted, taking on a yellowish tint that just doesn't look natural anymore. Or perhaps, and this is a very common concern that people are often too embarrassed to talk about, you've noticed a lingering odor. You clean them, you rinse them, but that denture smell seems to come back way too quickly. You might be wondering, what am I doing wrong? I brush them every day. Well, the reality is that caring for a prosthetic is fundamentally different from caring for natural teeth. And unfortunately, the instincts we've built up over a lifetime of brushing our natural teeth are actually the exact things that end up destroying our dentures. I have seen so many perfectly good prosthetics ruined, scratched, stained, and smelling bad, simply because the owner was trying to keep them clean using the wrong methods. So, I'm going to walk you through the definitive guide on how to sanitize your dentures correctly. We are going to cover everything from the products you should never touch to the specific tools you need to buy and a nightly routine that will ensure your smile stays bright and, most importantly, healthy for years to come. If you follow these steps, you won't just extend the life of your prosthesis, you will likely save yourself a lot of money and social anxiety. Let's start by understanding the why. To clean your dentures properly, you first need to understand the material you are holding in your hands. Your natural teeth are covered in enamel, which is the hardest substance in the human body. It is incredibly resilient. It can withstand heavy brushing and abrasive scrubbing. Your denture, however, is likely made of acrylic resin or a mix of metal and plastic. While this material is durable enough to chew food, on a microscopic level, it is much softer and more porous than natural tooth enamel. Think of your denture like a piece of high-quality plexiglass. If you were to take a piece of sandpaper and rub it on a window, you would immediately see scratches. The same thing happens to your denture, but on a level you can't always see with the naked eye. This brings us to the absolute number one mistake that almost everyone makes when they first get dentures. You must stop using regular toothpaste to clean your removable appliance. I know this sounds counterintuitive. You've used toothpaste your whole life to clean your mouth, but toothpaste is designed for enamel. It contains abrasives, tiny gritty particles like silica, that are meant to scrub away plaque from a hard surface. When you apply that same gritty paste to the softer acrylic of a denture, you are essentially sanding it down every single day. When you scrub a denture with toothpaste, you create thousands of microscopic scratches and grooves on the surface of the pink gum area and the white teeth. At first you won't see them, but these micro scratches become a safe haven for bacteria and fungi. They are like deep valleys where microorganisms can hide, and because they are deep in the plastic, the bristles of your brush can't reach them to clean them out. This is exactly why dentures turn yellow and start to smell. That discoloration is essentially a stain embedded in those scratches, and the odor is the metabolic waste of the bacteria living inside the plastic. Once those scratches are there, it is very difficult to reverse the damage. So, rule number one, banish the toothpaste from your denture cleaning routine. Instead, the gold standard for mechanical cleaning is something you likely already have in your kitchen: liquid dish soap, a simple, neutral detergent. It is effective enough to break down the grease and food oils from your meals, but it is non-abrasive. It washes the surface without scratching the finish, keeping that acrylic smooth and polished, which makes it much harder for plaque and tartar to stick to it in the future. Now let's talk about the environment in which you clean your dentures. This brings us to the second most common mistake: cleaning them in the shower. Many people try to multitask. They figure, I'm washing my body, I'll just pop my teeth out and give them a scrub. The problem is that wet acrylic is incredibly slippery. When you add soap to the mix, it becomes like holding onto a bar of wet soap. In the shower, if that denture slips out of your hand, it has a long way to fall, and it's landing on hard tile or porcelain. A drop from that height is catastrophic. The acrylic will shatter, or a metal clasp will bend, rendering the denture useless. You do not want to be in a position where you have to pay for a repair or a replacement simply because it slipped in the shower. Here is the correct setup. Create a safety zone at your bathroom sink. Before you even take the denture out of your mouth, partially fill the sink basin with water, or lay a thick, folded hand towel in the bottom of the sink. This is your safety net. If the denture slips from your soapy fingers during cleaning, it will hit the water or the towel, not the hard ceramic of the sink. This one tiny adjustment to your routine can save you hundreds, if not thousands, of dollars in accidental breakage. Now that we have the right soap and the right environment, we need the right tool. You need to go to the pharmacy and buy a specific denture brush. Do not use your old soft bristled toothbrush that you use for your natural teeth. Remember, we aren't using toothpaste, so the abrasion isn't coming from the paste, but we need mechanical strength to remove the sticky biofilm that adheres to the plastic. A regular toothbrush is usually too soft, and the head is too small to effectively clean the large curves of a denture. A denture brush typically has two heads. One side has a large, flat arrangement of stiff bristles. This is for scrubbing the broad surfaces, the teeth, and the pink acrylic curves. The other side usually has a smaller, tapered tuft of bristles. This little tuft is crucial. It is designed to fit into the deep channel of the denture, the part that sits directly on your gums. It's also perfect for getting into tight spaces around metal clasps if you have a partial denture. You need that stiffness to physically dislodge plaque, but because you are using dish soap as a lubricant, the stiff bristles won't damage the acrylic the way the grit of toothpaste would. So, the daily mechanical routine is simple. Over your towel-lined sink, apply a drop of dish soap to your denture brush and scrub every surface of the prosthetic vigorously. Make sure you get the inside, the outside, and in between the teeth. Rinse it thoroughly with water to remove any soap residue. However, mechanical brushing is only half the battle. We also need to talk about chemical cleaning and the importance of letting your gums breathe. There is a biological reason why you must take your dentures out at night. Your gums are soft tissue. They were not evolutionarily designed to be covered by a piece of plastic 24 hours a day. The pressure of the denture restricts blood flow slightly, and the coverage traps heat and moisture. This creates a greenhouse effect that is a paradise for fungal infections, like denture stomatitis, which makes the roof of your mouth red, inflamed, and sore. You need to give your tissues a rest. The best time to do this is while you sleep. When you take the denture out for the night, you shouldn't just leave it on the nightstand to dry out. Acrylic needs to stay moist to maintain its shape and durability. If it dries out completely, it can warp or become brittle, so it needs to be submerged. This is where you can introduce a chemical cleaner to do the work that brushing missed. I highly recommend using effervescent denture cleaning tablets. You can find these in almost any pharmacy. Brands like Polydent or Corega are very common. These tablets contain oxidizing agents that help kill bacteria and lift stains from the micropores of the acrylic. You fill a cup with warm water, never hot or boiling water, as heat can warp the plastic, drop the tablet in, and let your denture soak. I understand that using a tablet every single night can add up in cost. If you are on a budget, you don't necessarily have to use a tablet every single night. You can alternate. You can use plain water one night and a tablet the next, or you can cut the tablets in half to make the box last twice as long. The important thing is the consistency of the habit. A note on home remedies you might see online. Be very, very careful with bleach, sodium hypochlorite. While it is a powerful disinfectant, it is harsh. If your denture has any metal components, like the framework of a partial denture, bleach can corrode the metal, turning it black and weakening the structure. If you have an all-acrylic denture, a very dilute solution is sometimes suggested, but honestly, sticking to commercial tablets or just plain water and soap is safer and avoids the risk of you accidentally swallowing residual bleach or damaging the prosthesis. If you have a flexible denture, the kind without metal clasps that feels a bit more rubbery, the rules are largely the same, but you have to be even more gentle. That material is fantastic for comfort, but it is softer than traditional acrylic. The no toothpaste rule is doubly important here. The microscopic scratches on flexible dentures are even harder to polish out than on hard acrylic. We have talked a lot about cleaning the plastic, but we cannot forget the other part of the equation, your mouth. Actually, this is where most people fail. They focus so much on the denture that they ignore the dangerous bacterial biofilm building up on their gums, which causes that stubborn bad breath and inflammation. If you want to take your oral hygiene to the next level, you need to see this presentation about a strange, new red dental foam cleanse. It's a 10-second daily habit that targets that hidden bacteria and helps rebalance your mouth's natural defenses overnight. Scan the QR code on your screen right now to watch the short video explaining how this red foam works. I've also pinned the link to the top of the comments below. It's safer and faster than traditional methods, and it pairs perfectly with the routine we just discussed. Just because you have a prosthetic doesn't mean you stop brushing your oral cavity. Even if you have no natural teeth left, you still need to maintain oral hygiene. Bacteria grows on your tongue, on the roof of your mouth, and on the gum ridges. Every morning and every night after you deal with the denture, take a soft bristled brush or a damp washcloth and gently massage your gums, brush the roof of your mouth, and scrub your tongue. This does two things. First, it removes the bacterial film that causes bad breath. Second, and just as important, the massage stimulates blood circulation in the gum tissues, keeping them firm and healthy. If you put a clean denture into a dirty mouth, you are defeating the purpose immediately. So, let's summarize the perfect routine to keep your prosthesis looking brand new and smelling fresh. 1. Never use toothpaste. It is an abrasive that sands down your denture and invites bacteria in. Use liquid dish soap instead. 2. Don't clean your dentures in the shower. The risk of breakage is too high. Clean them over a sink filled with water or lined with a towel. 3. Use a specialized denture brush with stiff bristles to mechanically remove plaque, but rely on the soap for cleaning, not friction. 4. Take them out while you sleep. Your gums need to breathe to prevent fungal infections and bone resorption. 5. Soak them in water or a specific cleaning solution overnight. The chemical fizz of the tablets helps reach areas your brush cannot. And finally, clean your own mouth. Your gums and tongue need attention too. It might seem like a lot of steps at first, but once you integrate this into your nightly ritual, it takes just a few minutes. The payoff is huge. You will have a smile that stays white, breath that stays fresh, and a prosthetic that lasts for many years without needing expensive repairs. It is about consistency. Doing it right once a day is better than doing it wrong 3 times a day. Treat your denture with the same care you would treat a piece of fine jewelry, because in a way, that is exactly what it is. It's an investment in your quality of life, your nutrition, and your confidence. Don't let a tube of toothpaste ruin that for you. Take care of your smile, and it will take care of you.